I came about doing this work because I have a background in public health. I'm an attorney, and I was always interested in systems change and thinking about social determinants of health. I actually became an attorney for the city law department in 2016 when my son was 6 months old. And I said to my boss, I want to work on lead poisoning because I knew it was an issue in Buffalo. My name is Anna Falicov, and I'm the coordinator of the Buffalo and Erie County Lead Safe Task Force. We're a cross-sector collaboration of different organizations in Buffalo and Western New York that all work towards the goal of ending childhood lead poisoning in our region.
What factors make the lead crisis so high in Erie County, in particular in New York State?
It's kind of a perfect storm here in Buffalo. We have extremely old housing stock. Most of our homes were built turn of the century. We have a very poor community. We are among the poorest cities in the whole country. Deindustrialization and redlining have combined to create really terrible racialized poverty in our city. We can see that our houses are deteriorated, that there's a lot of deferred maintenance, and that old lead paint on porches, on windows, it chips and peels and flakes, and landlords have not maintained those units to standard. So we have this ongoing crisis. It's a 4-alarm fire, but we don't treat it like that because it's just been the backdrop for decades. We've become accustomed to it.
Yeah. Can you tell me about your work right now with your organization and where you think the deficits are and how we can grow?
Our orientation continues to be around improving the quality, frequency, et cetera, around rental inspections. We really need rental housing to be inspected to make sure that when people move into a home, it's lead safe. We have a lot of challenges related to a culture in Western New York of property owners doing whatever and renting out really terrible units that are not only hazardous in terms of lead, but are uninhabitable in many instances, that have mold, that have fire hazards, that don't have functional heating and cooling. As we were pursuing this work around rental inspections, we really realized that to be responsive to what families need, it couldn't just be lead. So our orientation is really around healthy housing. We have a shortage of safe, affordable units. I think there is a notion out there that, well, you're living in a poor quality house, just find another one, right? And that's just not a thing that people can do. There's a shortage of units. There's application fees. There's illegal discrimination based on Section 8 and housing choice voucher usage. So when a family finds a home, they want to stay there. We've been trying to balance that as we think about rental inspections, because on the one hand, someone's living in a truly hazardous place, you want them out. On the other hand, we don't have the capacity to house people. So it's a struggle. It also results in people not wanting to let inspectors in. They're concerned about retaliatory eviction in the event that an inspector does find hazards, and they're just also simply afraid of being told they have to move. We're not going to get out of this problem until we make a standard across the board that all units in Buffalo have to be lead safe. But that represents a big shift in the way we think about property and rental housing.
I don't think people really understand with the insurance bill that clause that doesn't allow a tenant to sue their landlord if their child is sickened with lead on their premises. Yes, of course, we want to get the means to be able to take care of that child, but it's also a deterrent. And that's another thing that I don't think people quite understand, that if a landlord can't get insurance because their home is full of lead, they're going to be more apt to abate.
It's a market-based solution, and it's not the only solution, but it's an approach, right? And we need it because we do that for all sorts of other things. You can't get your car insured if it's a jalopy and falling apart, right? Like, insurance company doesn't want to insure it. So in housing, it would work similarly, and it would create the right incentive structure to have property owners have their properties lead safe so they don't get claims.
Yeah.
The proactive rental inspections law that we passed in 2020 is designed to ensure that units are lead safe and habitable, meeting a basic standard of habitability. A very good bill, and I'm really proud. We've struggled to get that law implemented, but we're starting to see change. We have a new administration coming in Buffalo in January, and we're hopeful that administration takes lead poisoning seriously. We believe they will be. doing much more than the incumbent administration.
One of the candidates is State Senator Ryan, who actually was a lawyer for lead poisoning cases in the school district. Is that correct?
I think he represented them through neighborhood legal services. He has a background in housing. He definitely knows and understands lead poisoning, cares about it. So should he win, we're feeling really optimistic that things will change in City Hall. Not only do we need more inspectors, we need an enforcement system that really communicates to landlords that you've got to do this. You don't have to do it alone. We understand that making repairs is costly. We have a lot of smaller landlords in the city of Buffalo that are mom and pop. They might live down the street. They might live downstairs from the unit. So we're offering as many loans and grants as we can. You've got to get rid of it safely. You've got to learn about wet wiping and scraping, dealing with contamination. So we're working on all fronts, trying to improve the contractor base, improve loans and grants, add new inspectors, and enforce existing laws and potentially add new ones to make sure that landlords come into compliance.
There seems to be like a groundswell of people becoming aware that they need to be involved in their government. A democracy needs to have people aware, informed, and activated. I don't necessarily mean everybody has to write a podcast or start their own organization, but making sure that you elevate politicians that are going to actually do something about these issues is really important, and it's really important to just lend your voice. You can send an email and make a phone call to your local politician. If they know that you care about this issue, that you as a constituent care about this issue, they will care about this issue more.
There's so many people who are impacted by lead, even though it might not feel direct. What is the city doing about this? What is the school board doing about this? These systems are impacted by our inability to address lead poisoning. So it's on us to communicate that and to organize and agitate as many people as possible to make those phone calls and come to Albany.
The thought of this continuing, like, it literally makes me ill when I think that this is still happening, and it just doesn't have to happen. It's 100% preventable. If there's one thing that you would want people to know about lead, what would it be?
I think that it's still a risk to children. In Buffalo alone, in Buffalo and Erie County last year, almost 600 kids were poisoned. Yeah. This continues to be an enormous problem in our community, and lose sight of our goal, which is to make this an issue of the past, but we're not there yet. In the language of human rights, so the biggest kind of human rights violations we can think of in our society, and I think this is up there, that we allow children to have their lives altered potentially forever just because of where they happen to live as children. The injustice is so extreme, and everybody knows it's wrong and feels it's wrong, but what do you do with that feeling? How do you move it into action?
I'm buoyed and I'm inspired by the people that get up every day and really dedicate their lives to making this world a better place, and you're definitely one of them. It's a moral issue. We are allowing our most vulnerable citizens, our children, and especially children from marginalized communities, to be poisoned, and we need to do everything we can to stop it. I just want to thank you for your work, and thank you for your organization.
Thank you, Shannon. Thanks for coming to Buffalo and talking to us.
Yeah, I'll be back.
You'll be back.
Thank you.